to Monica. Should AI ever be allowed to make decisions that directly affect human life? Who says AI says also robotics. Freedom or identity without meaningful human oversight. What is the level of oversight we need to have?
Well, I think we're at this stage where we realize and we understand that there are harms from these systems. Very veritable, real, genuine harms that affect many individuals, affect all of us, frankly. And so my main argument would be that, yes, we do need to maintain oversight, but it boils down also to how do we maintain that oversight and to which values are we going to prioritize? And so working in an organization, essentially leading all the AI policy and governance of an entire hospital system. I mean, that is one of the central questions we're asking first, because we know we're going to be implementing AI technologies, we already are, but we're constantly asking ourselves, okay, how do we make sure that the users, so on this side, on the providers, clinician side, are actually using it in a way in which they truly understand how that system, how that tool is helping them with decision making, but then also, what does that mean for patients? Because patients are the ones in which the providers are providing care to, health care to. And so that, to them, they also get affected, and they also need to understand why, so that there can be true communication between both sides of the equation. And so for me, oversight really is the developers, the creators, the builders, knowing and understanding as much as we can, really breaking the black box issue, frankly, and coming from the world of translation of human intelligence into machine intelligence. That is one of the biggest questions we're working on, and because we don't even understand human intelligence completely. And so how can we dare to ask the question of what is machine intelligence? So how can we even then dare to say, what does transparency mean with machines if we lack a lot of transparency in how we do a lot of decision making? And so, but that is what's becoming the priority, because we know that those possible harms exist on the bias level, all across the spectrum on the ethical level. And so we realize that, yes, in order to be able to answer questions properly, that, and again, in healthcare example, that patients have to us as providers, we need to understand these systems. And the only way we can understand these systems is if we actually maintain a level of control. Because we know that if there are going to be errors, if there are going to be mistakes, if there are going to be just unexpected outcomes, we need to have an answer, in part because also we're dealing with life-death situation. And so I would say that really, when we're thinking about the impact, and I go back to that, that's just a critical point that you made when we talk about human-centered AI. It's really about what is the value, what is the meaning, what is the effect it has on us. We are the developers, but we're also the users of these systems. And so if we don't maintain a level of oversight, and I don't want to say partial, I really would argue for we really need to have oversight across the entire process, the entire workflow in which we're embedding these systems, fundamental.